Welcome to Health Stealth Radio, where we move away from the mundane to gather insights from the shadows of enterprise and patient cybersecurity. Yes, we surely believe that traditional themes like endpoint software and zero trust are critical, but given massive advances in AI, remote and wearable device hacking, and data hostage negotiators, there's a much darker side to cybersecurity, and not everyone is quite willing to talk about it in public. Health Stealth Radio will thrive on these topics and encourage fireside spats to debate them. Here's your host, Frank Cutitta.
I'd like to welcome you today to Health Stealth Radio. My name is Frank Cutitta, the host. I have the pleasure of having Navin Gupta, who is the CEO of Viventium. It's sort of interesting in terms of timing. More and more, we're seeing HR and benefits come into the mix, especially as they start tying into other aspects of the enterprise system. Lest we have to say for journalistic credentials, artificial intelligence at least once in a presentation. So I'll bring that up right at the beginning and then let Navin talk about it a little bit later. But I'm just looking more and more at how people are collaborating across the enterprise. We just did one on Compassion IT, which had the HR director from Intermountain talking about the relationship with the technology. I think it's an interesting dynamic because all of these things, especially when you start looking at cybersecurity, they start tying in together, whether it's in the healthcare enterprise or it might be a billing system or a food supply system that's totally unrelated to our business and what's happening in that too. So without further ado, I'd like Navin to introduce himself, tell me just a little bit about your career trajectory, how you got into this and where you are right now and what you enjoy doing with your free time.
Yeah, thank you, Frank. I really appreciate you having me. So my career has really been at the intersection of technology. That's where I really started. Healthcare. I was in acute care with Philips, and then transitioned into post-acute care. I've been with multiple companies, but it's technology, it's healthcare, and it's mission sort of growth-oriented businesses. I've spent a lot of time over the healthcare continuum and have seen how technology can meaningfully improve both patient, resident, and caregiver lives. And so that's what really, truly excites me. Before Viventium, I have an opportunity to lead Viventium, but prior to that, I was leading other healthcare companies in other private equity-backed organizations as well. Over the last decade or so, I've focused on post-acute/senior care specifically. So this means home care, home health, hospice organizations, skilled nursing, senior living, and now we do some work around ABA. Frank, you likely know this, but Viventium is really the only nationally scaled healthcare-focused human capital management platform. And we wake up every day supporting the full caregiver life cycle, and that means we've got a number of products that really make up the platform, from applicant tracking to onboarding to HR to schedule and time and compliance and benefits and so on and so forth. Yeah, so that's just a little bit in a bit of a nutshell of my background and what Viventium does.
So the word home is coming into care constantly right now, and so I mean and there are variations on theme of using home in there. Obviously, the big kahuna that everybody's looking for is the hospital at home and the waiver that went along with it. Could you tell me how that fits into your product mix?
No, so I think not specifically, if you think about SNF at home or a hospital at home, we don't necessarily play in that space. But I think the broader theme is that healthcare is moving to the home, right? So even within senior care, about 5% of the senior population are in communal settings, whether skilled nursing or assisted living or independent living. And then you have the rest of them really receiving care at home. Viventium really touches the full continuum. Our solutions really touch healthcare providers that are serving all of these populations, whether they're in community settings or at home as well.
So you have a number of constituents, I'm sure, that are involved in selecting your products. They all have different points of view about the workplace right now and the transitions that are happening and the revolution in some cases. How would you describe the biggest challenges of the workplace right now from a Viventium point of view?
By far, actually, the answer by far is workforce-related challenges. And one way to think about this is that in the US, we've had a slowly shifting demographics change, right? So even in the last 20 years, there are 500,000 or more fewer birth decrease or decline that's there. At the same time, by 2034, you'll have more seniors. than 18 and under, right? So you've got a vastly growing senior population that have chronic conditions that need care. And the challenge that providers face is care capacity. Sometimes, Frank, most people think when we talk about workforce challenges, it's just the number of bodies or employees or staff that need to be hired. The better way to view it is really in terms of labor hours. That's that. Clearly, you're going to need millions more of caregivers that's in there, but the ability for the right staff to be available, rightly credentialed to be able to provide care and delivery, that really matters more. So, if I were to punch it up in terms of what are the challenges that they face, first, they need more labor supply. That's number one. Second, their ability to use labor more effectively, right? Which means they want to reduce using third-party agency labor. They want to be able to maximize the staff that they have.
Right.
Third is they've got to reduce turnover, which is also a common problem when you have a constrained capacity that is pushed to do more because there just aren't enough. There is turnover issues that happen. And then underpinning all of this, Frank, in a healthcare environment is a highly regulated compliance that they have to adhere to. So, and all of these things that we really described is what Viventium really does for the healthcare market.
If you're putting people in the room that are buying the product, what are some of the titles that you would suggest that before we even start talking about this for our pitch, here's who we'd like to have sitting, and how many pizzas would you have to order?
Yeah. I would view them in multiple categories, right? From a platform perspective, you've got the core HR and payroll that typically have a finance component to it. So the CFO might be heavily involved in that. Then you have the core HR platform. You have recruiting that needs to be done, and compliance. That's the HR department, head of HR. And then you've got scheduling, where your caregivers are being penciled in for various shifts, etc. You've got a scheduling department that oftentimes is tied to the clinical workforce that's there, or in non-medical home care, there's just scheduling that really. So you've got multiple sort of constituents that are involved in it. I would say three broadly. It would be clinical care, it would be HR, it would be finance, and I would say one pie, depending on how many slices they have, to be enough.
Right. Every now and then we see a patient creeping into there as well.
Yeah.
So we've got to talk about AI because it's revolutionizing everything. Some would argue that it's dangerous. Tell me how AI has changed your business. And there's this interesting thing that we see universally when we're interviewing people at Chime, whether it be on the radio or at events, that technology people like AI until it gets close to clinical decision support and some of the scary stuff. Could you tell me how your product and your offerings sort of balance that we've got the scheduling and things which are, process automation type things, which seem to be acceptable and less scary. And then we're getting closer and closer to hyper-personalization at the patient level.
Yeah, great question, Frank. I spend a lot of time personally on really following the trends around AI, and I think every leader is doing the same, that they are beginning to spend time. Now, AI, I do believe, is going to change payroll, HR, and compliance, maybe even employee engagement. But I'm going to add a but in there. But in healthcare, it's going to matter even more and needs to be applied carefully because it's a highly regulated environment. And the systems that can make mistakes, it may mean that a caregiver does not get paid correctly. It may mean that a provider is out of compliance. So you can't just add generic AI on top of healthcare systems. So, I think but they are, to your point, they are very specific use cases that can be very thoughtfully injected. And I'll tell you what Viventium is really doing to make better decisions.
Okay.
In payroll, for example, AI can detect anomalies that can be caught early. For example, if within an organization there is a certain threshold in which people are getting paid, if there is a security breach or fault, and we see that where there's an anomaly in terms of what payments are getting dispersed, it can catch that. If there's missed punches, it can catch that as well. In HR and compliance, AI can help discover policy questions, both for administrators and for employees. You talked about employees as well. It can catch missed credentials, because Frank, think about this for a second, that if a schedule is assigned to a caregiver that is not licensed, not credentialed, maybe some of it has expired, there are real penalties that are associated with it.
Right.
You mentioned scheduling. I think in scheduling, AI absolutely help with being able to optimize the schedule based on the number of disciplines, based on the number of shifts that need to be filled, managing the census that's really available and bringing that in, looking at overtime that is going to be applied, and then just making sure that the caregiver, the shift, the patient slash resident, all of that work cohesively together.
Right.
So those are all the areas that we're working on. Even within we recently did an acquisition, or really Apploy and Viventium came together. Apploy has injected a lot of really interesting features within their application, from job descriptions or making optimizations of how jobs are viewed on job boards, or helping providers rediscover candidates that are in there. So you've got a product level injection of AI. We're injecting AI within our business to drive efficiency and scale and give clients a better experience that they're looking for. So all of that really plays into the strategy. If you look at the foundational models by Anthropic or OpenAI, etc., I think there will be more utility that these organizations provide. And then you've got a push into the agentic era where you have agents that are coordinated. I can see healthcare agents that are coordinating between clinical systems, revenue cycle management systems, workforce operating systems like ours. Therefore, our applications becoming more agentic enabled. I see that part of the future as well.
Forgot to use that word too, agentic, of course.
Yeah. Yeah.
But you are probably seeing sort of the invisible, the electric fence when it gets to a certain point still, that there's still a caution?
I think that caution is the right caution. As I mentioned, like it's not generic yet, highly regulated, compliant environment. You must be very careful about how AI is used.
So let's look at the end customer. We look at the caregiver experience, and the caregiver experience too obviously is giving it to the patient. So what do you see is changing in that caregiver slash patient family experience that fits well with the kind of technology you're developing?
Yeah, so thank you for pointing that out. I think healthcare has often been focused on the patient experience, which they should, right? Patient slash resident or client in home care. But patient experience is directly connected to caregiver experience, right? Because if a caregiver is frustrated, confused, they experiencing friction in the system, the paychecks are not accurate, they haven't been onboarded correctly, they don't understand what's happening with their benefits, these have an impact on their ability to drive care, which is connected to the patient experience. Like that's, we are laser focused on, when you think about the caregiver, think about their lives. They're rotating shifts, they're picking up extra hours, they're supporting families and maybe juggling multiple responsibilities. They may have last minute schedule changes that they are trying to manage as well. Where I see, Frank, technology able to help them is, if they we want to empower them through employee self-service, through technology, to say, hey, I want to take this shift, I want to move this shift, I want to make my time capture very simple. One of the things that Viventium has done with our time solution, for example, is when you're punching in, you don't need to stand in line necessarily, because there's a single kiosk. You can use a barcode, you can scan from your employee self-service to say, I've punched in. Making pay more predictable, Frank. For example, for Viventium in our pay stubs, we show them the details behind how they're getting paid, which is very, very unique. It's just not, hey, 40 hours, 50 hours, and here's your hourly rate. We break it down by, here are all the days you work, here are all the hours you work, here's your regular hours, here's your overtime hours. So this prevents any payroll surprises. We also partner with other organizations like on-demand pay. For example, Frank, you get paid every week, for example, 40 hours or maybe more than that. But at the end of day 2, you have the need for access to your paycheck. We make it available. You don't have to wait for payday. You can get that access today. We do other partners with voluntary benefit organizations that can provide additional benefits to caregivers. The caregiver retention is the biggest part of the economics that most people don't see the connection, because once you lose care staff, you've got to hire them, you've got to onboard them, you've got to get them productive. And this is a loss in revenue, loss in the ability to take care, loss in ability to advance mission. This is why we're deeply passionate about making sure that purpose-built healthcare platform through the lens of the caregiver, and then supporting the employers from a compliance and regulatory perspective.
What are some of the key elements of where you see caregivers saying, I'm going to stay here because they've made this kind of change? What's the retention play?
I'll give you a real example, which we have had caregivers take Viventium Space Stub, go to a different home care agency where they're looking to work, and say, I need this level of paid transparency if I'm to join your organization, right? That's very powerful because
Sure.
pay means a lot, and especially when you're talking about um, uh, where it's directly connected to the quality of experience, quality of life that they really have. That's just one example I can give you of where getting it right. Onboarding is another very specific example where we say you can onboard your I-9s or other documents that you have directly from your phone, and you can be productive really quickly. All of those experiences matter deeply.
So underlying all of this is a very complex employee regulatory environment. When you get into healthcare, it gets even crazier in terms of how we have to look at privacy and data and things like that. How would you describe your product relating to compliance and the other word that, 5 years ago we would say, I'm going to miss a meeting because it's about governance today. And now everybody goes to governance meetings because they're going to miss something really important. So how would you say the compliance and government aspects are covered in the platform that you have?
Frank, it's a really good question. And I think it's important for the listeners to understand what a healthcare specific human capital management platform does that's uniquely different than generic HR and payroll systems, right? The first area is, I would say, wage and hour compliance. And these are very complex pay rules with shift differentials and overtime and multiple roles, multiple locations. How is overtime calculated across multiple EINs? What happens when you miss punches? Or what is working in unions, travel time, and sort of the implications around retroactive, which is very common as well, Frank, where a caregiver might submit a timesheet, from 2 weeks ago,
Right.
but you've got to be able to make sure that you calculate the overtime correctly. A single mistake there, your risk goes up dramatically. And these are all specific things tied to healthcare. The second is credentialing and exclusion monitoring. So that our workflows and compliance, our compliance is built into the workflows. So this area of making sure you're credentialed, you're licensed, that you're not on OIG exclusion list. So qualified, licensed, credentialed, absolutely important in healthcare. We do that flawlessly, and it's really, really important. The third area we support, we do it indirectly, but we do support is service level compliance. So think about EVV and time tracking and things along those lines with visit verifications. All of that is also part and parcel of what compliance really looks like in healthcare. And finally, when you think about ACA compliance and ACA benefits and leaves and all of things along that, Medicaid related reporting, we do PBJ reporting for skilled nursing facilities wherever they are Medicare and Medicaid. There are very specific requirements that providers need to comply with. And all of that really from a workforce perspective, from a labor perspective, is what Viventium uniquely does. It's not about just calculations, it's about compliance. And that's what Viventium is very, very focused on.
That's interesting. So as we're seeing these regulatory and compliance changes coming, what are you finding that organizations are doing in terms of consolidating the central source of truth for these things coming out of Washington or wherever they're coming out of? And also, where do you see, I'm digressing from the original question, where do you see the workforce changing to accommodate some of these things that are happening in the segment that you're in?
If you're referring to laws and compliance, Frank, specifically, it's very difficult for a organization to keep abreast with everything that's really going on, right? The partnership really matters. It's funny enough, Frank, we just half hour ago, we were on a call with hundreds of our clients. We do something called Vital Brew within Viventium. It's our quarterly catch up or huddle with our clients where our regulatory and compliance team talks to our clients and makes them aware of here are all the different things that are happening on the compliance side of the house. And this is both at state level, at various jurisdictions, at a federal level as well. So that's the first thing, is empowering the knowledge to the providers. The second is building it within the product itself, right? So there's some I-9 changes, et cetera. Our regulatory and compliance team will assess, understand what it is. It goes to our product team. It goes into our engineering team. It brings it back into the platform so that the providers then know that they can stay compliant. So I see that as a partnership. Providers need to stay compliant. Viventium is their partner. Viventium's job is to inject them into the technology or educate them as necessary of what's going on.
That's great. So if we start looking into the future, if we're future proofing this, we're going to have people saying, well, 5 years ago, I said, if I only dreamed I could do this with this platform in 2026, This would be so much better. From the future vision point of view, where do you see artificial generative whatever going in terms of changing where your product could be, as many products have been, unrecognizable in
Yeah,
only a matter of a year?
yeah,
I'm talking about an example is what ambient was a year ago
yeah,
versus what ambient is right now.
yeah. And I know we talked about it. That's changing how charting is happening,
Yeah, yeah.
how progress notes are
And
being done.
it's also become table stakes to even talk to
Exactly.
people. Yeah.
Exactly.
Okay.
If I were to look ahead into the future, it's important for Viventium to follow how providers are going to evolve because ultimately we are serving them. And we firmly believe that providers that will be disproportionately successful will have some they would do some things in a much more differentiated fashion. The first of which is workforce orchestration. They would understand the need for a purpose-built workforce platform
Hmm.
that helps them hire quickly, onboard, pay accurately. So qualified caregivers, and they are available to fill the demand on the hours that they really that they
Right.
really need because their growth is again tied to care delivery models, in terms of patients, residents, clients that they really have. So workforce orchestration is number one. Number two is caregiver experience. As I said, patient care and resident care
Hmm.
directly linked to caregiver experience. So how quickly they can hire, how quickly they can retain, and I've said this before, providers will never be able to hire themselves out of a retention issue. It is absolutely critical and important for them to really watch out for things that they really need. And simple things like a caregiver has to log into 5 applications or use 5 mobile apps. Frank, you know this. You cover the wider healthcare landscape.
Hmm.
That is a problem. Pay accuracy, pay transparency is going to matter. Benefits are going to matter. All of that will give them a distinct advantage. And the third is compliance cannot be an afterthought. I share this very, very often when I worked on the EHR, electronic health records side of the
Yep.
house. We were competing against another vendor, and I used to ask the clients or the customers of this vendor and say, "Why are you with them?" And you know what they used to tell me? Navin, I can sleep well at night. And I say, "Help me understand that better. This platform, even if I wanted to get out of compliance, will not allow me to get out of compliance." But it was on the clinical side of the house. Viventium is essentially trying to help our providers stay in compliance. So workforce orchestration, caregiver experience, and ultimately compliance. If you can solve this now, the AI, to your point, with generative AI, LLMs, I think these technologies will allow to support a better expression of this. But these are the problems that providers are looking to solve, and Viventium is laser focused on doing that for them. I see that's how the future is going to look like.
Very interesting. I wanted to jump back to another theme, which is not quite as exciting, but really, really important these days. You mentioned service level, the two words service level.
Yeah.
Every time I hear service level, the word agreement comes up afterwards. So I'm wondering, as people are purchasing products like your own, is there an evolution of service level agreements as we've known them, where it's like telecommunications, dial tone on, dial tone off, or are you seeing a change in having more skin in the game in terms of service level agreements that your enterprises are requiring you to sign?
Yeah. So maybe just a clarification on that. Are you talking about service level agreements that we offer to our clients, Frank, or are you talking
Yes,
about?
when they sign, it would be for a service level agreement of providing,
Gotcha.
just
Yeah,
making sure service is on, which is like
yeah,
the old telecommunications version,
yeah,
or making sure it's matching with business goals, or in your case, maybe retention goals.
yeah. Frank, I think it's a good point. It's interesting now that with the rise in LLMs and sort of general intelligence that's being created through
Hmm.
AI, people are now focused on outcomes more than anything. I mean, services is now growing. Like people are viewing
Yeah. Oh, yeah.
services to say, look, do I want more outcomes based, right? Which means I need my payroll to be accurate. I need my payroll to be paid in time. Clearly, I think to your point about telecom, but it applies in IT as well, is hosting. I need my system to be up 99.999%, like that, having that level of confidence
Yep.
that's there. Or when I submit a payroll, that it gets processed within a certain amount of time. Or when I hire, it gets
Right.
pushed into my job boards. And absolutely, it's interesting that the amount of data that Viventium and Apploy has just over the longevity over multiple decades gives us unique insights within post-acute healthcare. All of these data points that allow us to fine tune it. And that you said it's not an exciting question. It actually is an exciting question.
Yeah.
If you are to deliver great service, you have to be able to benchmark against what the baseline is and what do we do to improve it.
Thank you for making it exciting. Just closing question here. I'm sorry, I wish we had more time, and we'll certainly bring you back for more. We have an audience here, typically of healthcare technology leaders
Yeah.
in their own organizations. I'm curious, even though most of them are skilled, they've been in their jobs for a long time and work with HR. What do you think is one of the top things that these healthcare IT leaders are underestimating about workforce trends?
Yeah, I think and we've talked a great deal about it. One is auditing the platforms that you're using for workforce management within your business, and are they generic or are they purpose built for your? That's by far the number one, because as I said, we talked about all the unique things that Viventium does is because we are waking up every day for this end market in skilled senior living, home health, hospice. So evaluate that. Second is, are you using numerous solutions, point solutions, or do you have a platform that gives you a normalized view of data, right? So if you use a distinct time solution,
Right.
a distinct onboarding solution, a distinct applicant tracking, and a distinct payroll, guess what? You're going to get a fractured experience of all the data. If you want to unlock AI, you need a single normalized view of data that is clean. That's the second thing. And the third thing I would say is, how do you think about cyber and security? Not on generic platforms, but through a healthcare lens. And does your partner begin to offer that? Ultimately, the outcomes are healthcare IT leaders are supporting the finance organization, the clinical organization, the HR organization. What are the KPIs that ultimately matter? What is my time to hire? How likely am I to retain the people and the staff that I have? Regrettable attrition, you're tracking that. You're talking about how many shifts go unfilled, how much overtime that I'm having to pay. Am I staying in compliance or not? So I think, how can healthcare IT leaders be good partners on the business side and measuring it through all of that? So I guess that just sums up, like, more broadly, how should healthcare technologists, which I'm a technologist myself, and being good partners on the business side to drive business outcomes and advance mission is going to be critically important.
Great closing remark. We appreciate that. And we appreciate the time today and hope we get you back, because we're going to expand our coverage on the relationship between workforce, HR, and the other pillars within the enterprise. And I think you and your colleagues will be perfect for giving us the trends in that area. So, Navin, thank you so much.
Thank you, Frank. Really appreciate it.
Thank you for joining us today in the shadows for this episode of Health Stealth Radio with Frank Cutitta. If you like the program, please be sure to share your comments on our social media sites, or feel free to contact us with suggestions for new and stealthy show themes. We look forward to welcoming you again for our next broadcast. In the meantime, stay safe out there.